So let's look at the pelvic outlet. This is the inlet. This is the outlet. So outlet is the ring of bone and fascia that is at the bottom of the pelvis. So the pelvic floor is a major part of the pelvic outlet, as are these other structures. The bony ridge, which is formed by the ischiopubic ramus. So from the ischium to the pubis on both sides in the front. So ischiopubic ramus on both sides, and of course the urogenital triangle of the pelvic floor. Wrapping around, as you can see, the sacrotuberous ligaments make up the back of that pelvic outlet. So in the front of the pelvic outlet is the ischiopubic ramus on both sides, and in the back is the sacrotuberous ligament on both sides. Also, what you will notice is kind of the hero in all of this in vaginal birth, the tip of the pelvis, and then the anococcygeal ligament, which is right here. So we are going to learn how to bring about more mobility in these structures, as well as that anococcygeal release. We will go very briefly into that as well. Orienting this way. So if you were looking at your client from the back, this is sacrum, this is tailbone, and as we know from our initial informational slides, birthing positions that allow for a free tailbone, that allow for this bone to be free so that the tailbone can move out of the way so that it can extend. So the bone is oriented in this manner. This is flexion, where it bends more as we do a Kegel. This is when it extends more as we do a reverse Kegel. So Kegel, flexion, reverse Kegel, extension. So this tailbone should be able to extend out of the way so that the pelvic outlet can open, right? So positions that allow the coccyx to move out of the way are when the person is not lying on their sacrum. So these are the birthing positions that are covered in our birthing modules, the birthing position modules. We are going to do releases in this module, which will release these ligaments, the sacrotuberous ligament, as well as the anococcygeal ligament, so that this pelvic outlet can expand for easy release and drop of the baby. What this also does is in those late weeks of pregnancy, 36 weeks, when we do want the pelvis to start getting more flexible in a lateral manner, loosening these ligaments just creates a little bit more space for baby to start engaging, for baby to be at that zero station, maybe even be a little lower. So that is what we help with by releasing the pelvic outlet, which is the sacrotuberous ligament in the back, and a little bit of that anococcygeal ligament. And in the front, we really cannot release a whole lot besides the anterior pelvic floor, but it is formed by the ischiopubic ramus and the urogenital triangle, and in the back by the anococcygeal ligament, the sacrotuberous ligament, and the posterolateral pelvic floor. Now we have known that all of us know how to release the posterolateral pelvic floor. This is the bulky part of the pelvic floor, that layer 3 of pelvic floor muscles that we are so adept at releasing. And as you keep watching, you will learn techniques on how you can take that a bit further and use a vaginal approach, use an anal approach to go a little deeper beyond this muscle and get into this ligament for a much greater pelvic outlet opening.